This is Dr. Craig Banks with Pinnacle Chiropractic. I'm here today with Dr. Timothy Coe. We're going to be talking a little bit about our expansion at Pinnacle, where we're going to be adding our max recovery and cryotherapy wing. Of course, we're going to be doing some medical services here as well, so we're really excited about that. We wanted to talk with Dr. Coe and what his role is going to be and some of the things we're going to have to offer. So Dr. Coe, and I'm going to call you Tim since we've known each other since we were, 10.
Yeah.
What is your role here and what is your background? Most importantly, let's start with your background.
Sure. So my background is pain management. And for those of you that aren't aware of the medical field, it stems from anesthesiology. It's a subspecialty. So I'm board certified in anesthesiology and pain management. The main things that we do in pain management are address chronic conditions. Some of the training that I have involves medication management as well as procedure-based treatments. A lot of those procedures are spine related as well as major joints. And so this background, I think, is going to help expand some of the services that you're going to provide here.
Awesome. So your role here is going to be as medical director.
Yes.
You'll be kind of guiding all of that. One of the things we're looking at adding, obviously, as part of that medical is something called regenerative medicine. It's a big buzzword. A lot of people don't really understand it. They don't know it's a relatively new thing overall. Tell us a little bit about what regenerative medicine is.
Well, regenerative medicine it's pretty new. It's in its infancy, and there's a lot of research going on regarding the treatment and things that are available. The overall goal, though, is to assist our bodies in healing itself. And that can be done with some of the products that we'll be offering, as well as some of the procedures that we can do to concentrate some of the healing factors and then place them into areas where there's tissue injury.
And obviously, with us being originally a chiropractic office, this fits so well because we're really working towards healing versus just covering up constantly.
Yeah, I think it'll be a good complement.
Awesome. And I know we've decided to use a company called Predictive Biotech. They've been around since, I believe, 2005, and they've offered some products. So tell us a little bit about Predictive Biotech, if you know about them.
Well, they've been around for a while, and they've treated thousands of patients. The products that they provide are from human donor cells. And so those are some of the products that we'll be offering to patients that are struggling with injuries.
Okay. And I know that one of the other things we've talked about is something called PRP. Many people have heard of that. Maybe they don't know what that is. Explain what PRP is for our patients.
PRP stands for platelet-rich plasma. So it's a component of your blood that's rich in healing properties. So the way that we'll access that is by taking blood from a patient and then spinning it down in a machine that will kind of concentrate all of those healing properties. We'll then take the top part of that spun down product of your blood and re-inject it into areas that have tissue injury and hopefully stimulate the healing process.
Who, as far as patients go, who do you think is going to benefit more from PRP versus our donor cell products?
Well, we think that younger patients and athletes will probably do better with PRP. The older patients may do better from donor cells, and those people with more degenerative and more serious conditions may do better from the donor cells.
When it comes to Predictive Biotech, we're looking at offering 4 of their different products right now. I know 2 of them come from amniotic products, and then 2 come from something called Wharton's jelly. I know that many people are sitting here envisioning Smuckers or something else. Explain a little bit about the amniotic products, where those come from, and then also what is Wharton's jelly?
So Wharton's jelly it's a component and a gel-like material that comes from the umbilical cord. Predictive uses this product and obtains it from healthy full-term deliveries. So if that's a concern for some patients, don't worry, it's coming from a safe source, right?
Same thing with the amniotic cells. It sounds
correct. It comes from a different segment. So the Wharton's jelly is actually a higher concentration of all those ingredients that are going to help your body heal. Some of those ingredients, and for those of you that are interested in the more technical terms, MSCs or mesenchymal stromal cells, there's a much higher concentration in that than there is in the amniotic, as well as hyaluronic acid and exosomes. So for those of you that are interested in researching that, we can go through that in more detail when you do your consultation.
Wonderful. And then the amniotic ones, those are a little bit lower in concentration. They might be a little bit more affordable for some people, but they also have different benefits. I know that one of the products has a scaffolding effect. The Amniocyte Plus has a scaffolding effect.
Yeah, and so that's good for people that are struggling with soft tissue injuries, rotator cuff injuries, tendonitis, and ligament type of damage. And will help guide you through the process and the decision-making process.
I almost envision almost 3D printing over top of a tendon, kind of trying to strengthen that. I mean, that's what it is at least in my head. Is all of this stuff safe?
It is, and we've selected a vendor that's going to rigorously purify the products. They also do multiple testings to make sure that there's no contaminants and no risk of infection.
How long does a typical regenerative medicine treatment take?
Well, it's different. The procedure, if we're talking about the platelet-rich plasma, that's going to take a little longer, 20 to 30 minutes, because there will be a blood draw and there will be some processing time of the product. We'll have to spin it down and then re-inject it. For the donor cell injections, that's much quicker. You can anticipate 10 to 15 minutes, but the actual being stuck with a needle, that can take 60 to 90 seconds.
For those people who are a bit squeamish about needles, like perhaps I am, of course, we want to know, does this procedure hurt?
Well, I like to use a topical freezing spray. So it's an icy cold spray that's going to numb the surface of the skin. So as far as the pinch of the needle, that's minimal. And you may have a sensation of fullness as the injection goes in. So, 20 seconds of maybe some discomfort, but most people tolerate it pretty well.
I mean, we can handle that to get the relief. So the next question we have is, when will I feel the benefits from this type of treatment?
So again, that varies. Some people will feel better right away. And for most people, within 2 to 3 weeks, you'll start to notice a difference.
Well, listen, we want to thank you for your time, and thanks for answering all these questions. Obviously, you guys will be seeing a lot more of Dr. Ko down here. He'll be down here. We'll be starting to schedule appointments at the office. Starting after the 15th, we'll be working off of Dr. Ko's schedule for these specific things. But if you have any additional questions, feel free to contact us at the office, 330-928-2273, or you can email us at contact@pinnaclechiro.com, which is at the bottom of your screen right now. Thank you very much. Thank you, Dr. Ko.
Sure,
We look forward to seeing you at Pinnacle.